Name is Mike Jackling, and I work for Pro Benefits of Washington. We are part of the Capital Benefits Group. We're located in Bellevue, Washington, and serve both Washington and Oregon states. As a licensed insurance agent, my role is to assist individuals in navigating Medicare and related matters. My goal is to make the transition easier and to be a trusted resource. Today, I'll provide a high-level overview of Medicare and related topics. Common questions we will cover today. What to expect as you approach Medicare eligibility? What are original Medicare benefits, Parts A and B? What is a Medicare supplement, also referenced as a MediGap plan? Does Medicare cover dental, hearing, or vision care? What is a Medicare Part C, also referenced as a Medicare Advantage plan? What is Medicare Part D, prescription drug coverage? Next steps and available resources. Enrolling in Original Medicare, entitlement to Medicare may be triggered by several circumstances, including turning 65. Which benefits may begin as early as the first day of the month you turn 65. 24 months after receiving Social Security disability, loss of employer group coverage if you had delayed. Enrolling in Medicare can be completed a few ways. Directly through your Social Security office, applying online at www.ssa.gov, or by calling 1-800-772-1213. If you continue to work and have employer group health coverage, you may want to delay your Part B coverage until you retire or lose coverage, whichever comes first. Please note, group size may impact considerations. If you're working for a small group employer, you may want to check with your employer, insurance company, or the Social Security Administration for any additional considerations. Technically, you will have 8 months after losing your employer's health insurance to enroll in Part B without penalty. COBRA does not qualify as creditable coverage to avoid a penalty. Your money. Let's take a look at how the money flows. When you enroll in Medicare A and B, you will be billed for the Part B premium. CMS, under the U.S. Department of Health and Human Services, then pushes funds to either Original Medicare A and B or a Medicare Advantage Part C plan, which is a private insurance company extending Medicare benefits. Most individuals secure their Medicare coverage in one of two ways. First, one enrolls in Medicare A and B, Original Medicare, and adds a MediGap or supplement plan as well as a Part D plan. This method may entail 3 cards and 3 billings. Medicare drives what is covered. Medicare supplements, also called MediGap plans, are standardized and designed by the federal government, but are administered by a private insurance company or companies. MediGap plans are identified by letters ranging A through N. They provide coverage for some healthcare costs that Original Medicare alone does not cover, such as copays, coinsurance, and deductibles. MediGap plans pay secondary to Medicare on Medicare-approved services. If Medicare does not cover something, the MediGap will not cover it. Medicare must cover a service for the supplement to cover it. You must be enrolled in Medicare A and B before you can enroll in a MediGap plan. MediGap plans do not include prescription drug coverage. If you would like drug coverage, you can purchase a standalone Part D plan. MediGap plans are not tied to a provider network such as a PPO or HMO. A participant may use any provider that accepts Medicare. Some MediGap plans also have foreign travel emergency coverage because Medicare does not cover us out of the country. If you purchase a MediGap plan, you pay a monthly premium. Many MediGap plans have lower out-of-pocket costs than other Medicare options. However, their premium usually costs more than a Medicare Advantage plan. The second option would be a Medicare Advantage plan, or also referenced as a Part C plan. They are health plan options approved by Medicare and are run by private insurance companies providing your coverage. When you choose to enroll in a Medicare Advantage plan, you choose to have a private health insurance company administer Medicare for the federal government. They provide your Part A hospital insurance, B medical insurance benefits, and cover all the medically necessary services that original Medicare provides. They may even extend some extras such as dental, vision, or maybe even alternative care. Medicare Advantage plans with prescription drug coverage usually have a lower premium in comparison to enrolling in a Medicare Part A, B, and a Medicare supplement, and an additional Part D plan. It's comprised of having both Medicare Parts A and B. Medicare Part A is hospital insurance. Part A covers things like inpatient hospitalization, skilled nursing facility, hospice, home health care. What does Part A cost? You usually don't incur a monthly premium for Part A coverage as long as you have paid Medicare taxes while working for at least 10 years or 40 qualifying quarters. Medicare Part B is medical insurance. It covers things such as doctor services, outpatient hospital services, some home health care services, durable medical equipment, injected or infused therapeutic drugs, and certain medical and health services not covered by Medicare Part A. What does Part B cost? $185 is the monthly standard Medicare Part B premium for 2025. This gets adjusted annually. It is generally deducted from one's Social Security check. However, if one is not collecting Social Security, Medicare will bill for the premium. The Part B premium varies for higher income earners. It's worth noting Part B has a $257 deductible before Medicare pays 80% for most Part B services, leaving the Medicare beneficiary the responsibility of 20%. There is no out-of-pocket limit under original Medicare Part B. Cost sharing and IRMA, income-related monthly adjustment amount considerations. For 2025, this chart displays the Part B premium and IRMA considerations combined. Medicare will utilize one's tax filing status and modified adjusted gross income from 2023 for 2025 considerations. This will be adjusted each year. In 2026, they'll look at one's 2024 MAGI. Let's consider two examples from the table. An individual tax filer who made $106,000 or below in 2023, their Part B shows to be $185 per month. A couple who made between $266,000 and $334,000 will have a $185 Part B plus an IRMA charge of $185 for a total of $370 per month. This premium is for each. If you are billed for a Part B IRMA, you'll have another IRMA charge related to Part D if you enroll in a Part D plan, and we'll cover that more later. Let's look at how a Medicare supplement plan works. When you receive medical services, you give your provider your Medicare card, and you give them your Medicare supplement or MediGap card as well. Medicare in turn will pay its responsibility, and the MediGap will pay the balance based on your plan. There are many MediGap options to select from. Plan G is the best available to someone turning 65 today. This chart assumes Plan G. Medicare supplement plans. A Medicare supplement policy is a health insurance plan sold by private companies to fill in the gaps in original Medicare costs incurred. These plans are also referred to as MediGap or bridge plans. Medicare supplement plans offer the same benefits as original Medicare and do not have added plan benefits above what original Medicare offers. You must have Part A and B and continue to pay the Part B premium. A MediGap policy is standardized, A through N. The benefits included in the plan you choose are the same no matter which insurance company provides it to you. For example, a MediGap Plan G with each carrier is exactly the same, though the premium or service level may vary from carrier to carrier. Medicare supplement plans continued. Medicare is the primary insurance and they determine whether something is covered. The supplement plan simply follows Medicare's lead in how to process the claim. Medicare supplement plans do not use insurance company networks. Since Medicare is the primary insurance, the provider must accept original Medicare. Some providers may accept Medicare but not assignment. These providers may be considered non-participating, which allows them to charge an extra 15%. This must be disclosed. You're not required to list a primary care physician, PCP, and referrals are not required. Plans automatically renew each year. The benefits rarely change. The only thing that can change on an annual basis is the monthly premium. Medicare covered services are services that Medicare deems as medically necessary. Some things that Medicare doesn't consider medically necessary are cosmetic services, investigative or experimental services, alternative care, which includes chiropractic, acupuncture, naturopath, and massage therapy, and routine dental, vision, and hearing services. This chart shows the MediGap or supplement plan options, A through N. Please note, C and F are no longer available. One must have turned 65 prior to 2020. G and N are considered top options. Some companies offer a Plan G with a high deductible. Medicare Part D prescription drugs. Part D plans are available to anyone who is enrolled in Medicare Part A, Part B, or Parts A and B. A Medicare Part D plan prescription drug plan is optional, but you may be subject to a late enrollment penalty fee if you do not enroll in one when first eligible. Part D plans are provided by private insurance companies. The monthly premium may vary by plan, and you're only allowed to have one Part D plan at a time. Medicare Part D IRMA, Income-Related Monthly Adjustment Amount. Like the Part B IRMA, one may be subject to a Part D IRMA. The easiest way to describe this, if one triggers IRMA in regard to Part B and they're enrolling in a Part D plan, they will have an IRMA charge. Medicare Prescription Payment Plan. New as of January 1, 2025. The program may allow one to spread their prescription payments out over the course of the year. It is available to anyone with a prescription drug plan with any Part D plan. If one is interested in the program, they would contact the Part D plan and enroll or get information. Medicare Part D, how it works. First, the deductible level. One may have to pay 100% of the drug costs until the deductible is met. Those may range from $0 to $590 in 2025. Some drugs may be covered for copayment at this level. Second, the initial coverage. One may have to pay copays or coinsurance for covered drugs, while the Part D plan pays the rest. Finally, the catastrophic level. Once one has had out-of-pocket drug costs for covered RX of $2,000, the plan will pick up the costs moving forward. The numbers may vary because of how the true out-of-pocket is calculated. Medicare Advantage, Medicare Part C. A Medicare Advantage plan is a private individual medical plan. Often provides several additional benefits not available with original Medicare. Does not replace Medicare. It pays your medical expenses instead of Medicare. Eligibility, you must have Medicare Parts A and B. You must live in a service area of the plan you want to join. Medicare Advantage, how it works. When you enroll in a Medicare Advantage plan, your Medicare Advantage card replaces your original Medicare card. Medicare prepays the Medicare Advantage plan insurance company. The Advantage plan insurance carrier then works with the doctor, hospital, or other service provider to manage or administer your health care. Types of Medicare Advantage plans. First, HMO, Health Maintenance Organization. One must use a primary care physician, PCP. You must stay within the network or services will not be covered. Exceptions to this may be an emergency circumstance. Networks of providers may change during the year. And second, PPO, Preferred Provider Organizations. Access in-network care from a list of providers. Again, the network of providers may change during the year. Allows one to visit any doctor or services provider who accepts Medicare. If using an out-of-network provider, they're not required to accept the insurance, and you will often experience higher cost share than if you would have stayed in-network utilizing an in-network provider. Access any doctor or service in-network without a referral, but please note, provider groups may require a referral. Third, HMO POS, HMO with a point of service. You must use a network. Networks of providers may change during the year. You would have a primary care physician, PCP, and medically appropriate referrals. Fourth, SNP, Special Needs Plans. These programs are available for qualifying chronic illnesses, Medicaid benefits, or institutional inpatients. Medicare Advantage plan structures. A Medicare Advantage plan has a benefit structure much like an employer group or individual medical plan most of us are used to prior to enrolling in Medicare. Rather than separating benefits into two service categories, hospital and doctor like original Medicare, the benefit structure of a Medicare Advantage plan lists specific services and the associated cost share. A cost share would be either a copay or coinsurance percentage of the cost of service. Medicare Part C or Medicare Advantage. Let's look at some of the considerations when selecting a Medicare Advantage plan. The monthly premium, the annual maximum out-of-pocket, inpatient hospital copays, physician visit copays, skilled nursing costs, ambulance costs, emergency room costs, Diagnostic testing such as lab work, imaging, x-rays, those costs. And finally, outpatient services such as a day surgery or administering Part B drugs. Plus, there are additional or may be additional embedded benefits or optional benefits included, such as a prescription drug plan, Part D plan, fitness programs, vision plans, dental plans, hearing benefits, transportation, even meals may be a consideration. The additional optional benefits are not always included, so check with a specific plan and confirm before enrolling. Medicare enrollment periods. Initial enrollment period, IEP. This begins 3 months prior to one's 65th birthday, runs through the 65th birthday month, and 3 full months following. Annual election period, AEP. This runs October 15th to December 7th for January 1 effective date. Medicare Advantage open enrollment period, OEP. This is available January 1 to March 31st annually. It allows one to switch Medicare Advantage plans, or you can change from Medicare Advantage back to original Medicare and select a Part D RX drug plan. Special enrollment period, SEP. This may occur at different times of the year. Examples may include moving to a new service area or lose employer group coverage. If you join a Medicare Advantage plan and it does not meet your needs, you have a one-time opportunity to change back to a MediGap policy within the first 12 months of your first enrollment in a Medicare Advantage plan. And finally, a 5-star rating, SEP. Medicare Advantage Plan 5-star quality rating system. Plans can be rated between 1 and 5 stars. Medicare establishes ratings for MA, Medicare Advantage, and prescription drug plans, Part D plans, using multiple factors from primarily 5 areas of consideration. Staying healthy via preventive services, managing chronic conditions, ratings of plan responsiveness and care, complaints, appeals, and voluntary disenrollment, telephone customer service. A 5-star rating is considered excellent. These ratings help you compare plans based on quality and performance. I decide, how much can I afford? Do I travel frequently? Will my doctor or hospital accept the plan? Are my prescriptions covered? Do I need referrals to see my specialists? How often do I use my medical services? Do I have any upcoming medical procedures and expenses? Financial assistance programs available. Medicare Savings Program, Medicaid, Low Income Subsidy, Extra Help, and prescription discount cards. Apply if you think you might be eligible for assistance. Medicare Savings Program or Medicaid in Washington. You can apply online at www.washingtonconnection.org, or you can go to a local community services office, or finally you can call 1-800-562-3022, extension 16129. For Oregon individuals, you can apply online at www.one.oregon.gov, or you can call 855-673-2372. Lastly, the low income subsidy It's extra help to lower or cut Part D costs. You can apply online at www.ssa.gov/Medicare/prescription help/. You can also go to a local Social Security office or call 1-800-772-1213. Prescription drug discount cards. Sometimes there's value in considering these programs. Who offers them, and how can you learn more? Here are 3 companies you could consider. GoodRx. Details can be found at www.goodrx.com. Single Care RX. Details can be found at www.singlecare.com. And RX Cut. Details can be found at www.rxcut.com. I hope you found this information of value. I am always available for more individualized conversations. Please feel free to call or email me, and I'll do my best to assist. My phone number is 425-526-3469. My email is mike@probenefitswa.com. Thank you for taking time to listen to this Medicare 101.